So welcome everyone to today's Doc Talk. We're going to be talking about supplements and self-care, and we really want this to be informational and something that you guys can walk away with some good information and useful material with. So we kind of divided it into what we considered to be the pillars of health in regards to supplementation. And so myself and Dr. DeLambert are here, and Dr. Melinda will not be joining us today, but we assure you we're going to go through all kinds of fun informational topics. So to get started off, we just want to remind everyone a little bit about the naturopathic philosophy and how it's maybe a little bit different than what we typically are taught in regards to more conventional medicine. So the beauty here is we find that we're working with not just the understanding of basic science, but also this beautiful understanding of our internal strengths, which we like to call the vis, which is this beautiful healing power of nature, and that need for our bodies and the natural world to find balance. And so we're going to be talking about a little bit more in regards to this today. And there's also this environmental component too, which we always like to consider as naturopathic physicians.
So given sort of that naturopathic philosophy, this is more the nitty gritty, scope of practice things. So as naturopathic doctors, we go through similar training as your MDs. So we have a prerequisite of undergraduate degree, and then we do a 4-year medical school in the naturopathic medical school. And then during that time, we use a lot of the same textbooks, but what makes naturopathic medicine so special is in the treatment modalities. We learn a lot more in terms of nutrition, botanical medicine, homeopathy, hydrotherapy, et cetera, et cetera. And so we sort of specialize in using the healing power of nature, essentially, in preventative medicine as sort of the way that we perform medicine.
So, and of course, we have to take boards and sit for these credentialing boards as well, just like most med students do. And in regards to this, the other piece here that we just wanted to touch on is that we're trained as primary care physicians here in the state of Washington. So our goal is always preventative medicine, and we want to do this as naturally as possible when we can, although sometimes we may need to use pharmaceuticals and higher level interventions. So
our approach at Prosper is there's 3 aspects to it. We like to find the physiologic balance first. So when we see a patient, we assess them, energetically, physically, and we talk through diet and lifestyle and all sorts of things to kind of get a sense for who that person is. And restoring physiologic balance has a lot to do with making sure that there are the required nutrients that the patient is getting, from your vitamins, your minerals, your fatty acids, your amino acids, and your macro and micronutrients. And then once we know that that is established, we want to make sure that the digestion and that the assimilation is happening successful. So we check through all the organ systems, make sure the GI tract is moving well, the bowels are moving well, etc. So we also like to, once that's established, make sure that we are protecting that healthy state. And again, sort of going back to that first slide, making sure the healing power of nature, that internal human nature, is maintained. And so that works by using antioxidant and anti-inflammatory support specifically. And then as things come up, symptoms or changes in quality of life, we again sort of add an extra layer there and make sure those are addressed in certain times of need.
So we want to always be thinking about the foundations. And when we're talking about something like supplementation, especially, we want to make sure that we're addressing the ability to absorb the nutrients that we're supplementing with first and foremost. So whenever we're working with a patient, we're trying to look at what are what we call the determinants of health. So those are the things that are going to help determine, are we healthy or are we not?
And this is one of my favorite topics because the determinants of health are indeed those bare bones. And so, the big external factors are your water, food, air, and shelter. But in naturopathic medicine, we want to make sure we're getting enough water. What's your hydration look like? Are we filtering out the toxins? Same thing with food. It's not just any food, not the standard American diet by any means, but are you getting nutrient dense food? Or is it anti-inflammatory? And again, is it low in toxins? Same thing with air. We don't often think about how important air is to our health in general, but air from the Ayurvedic perspective is your prana, is your life force. You can't go 3 minutes without air. And so making sure that we are exhaling sufficiently, sort of de-stressing in that way, filtering out the allergens in our environments. And same thing with our shelters, making sure we're healthy on the indoors, but that our external environment is also healthy, so we can sort of glean from it what we need to make ourselves healthy.
So let's take a moment and think about the internal factors that are considered determinants for health. So we've got our rest. Are we taking time to rest? Are we having enough sleep at night? We've got our movement. Are we getting our physical movement in, not just exercise, but actually going through the range of motion for our body every day? And then the ability to eliminate properly. So we'll talk about those emunctories here as well. So I want you guys to just take a quick second. And as we go through these, I want you to think, are you maintaining this component for your body? Are you really nurturing yourself with this component, or is this an area that you need to focus on and maybe even make a New Year's resolution around? So rest, this is my big challenge area. So sleep, are you getting enough? Are you taking the time in the evening to close the computer screen, finish off the work, or turn off the Netflix or whatever video you might be watching, and really taking that time to get into bed in an adequate hour? What are you doing in regarding to stress relief throughout the day? So not just like, am I getting enough sleep at night, but am I resting, taking that mindful time to rest during the day? And then creating that actual space so that you can rebalance yourself if you are finding yourself out of balance. And that being really critical, of course, in regards to self-care, because a lot of times people will come to us and they say, I want to get better, I want to get better. And we look at what they're accomplishing and their goals are in regards to what they have to do and maintain throughout their day or their week. And maybe they don't have any time to actually allow that healing process to work. So as far as movement, we want to be, of course, thinking about, am I getting my exercise, my aerobic activity? But more importantly, what am I doing with my body throughout the day? It's the every moment stuff that really stacks up. So thinking about what your alignment's like, how you're holding your musculature and your bones in regards to stacking, that affects our bone health long term. We're going to get into bone health today as well. And of course, the strengthening components and the stretching components. Are we taking time to get our stretching in, as well as the active strengthening exercises like weight bearing exercise? And then what about this emunctory piece? So emunctory is a fancy name for basically elimination pathway. So we think about, we poop, we pee. So there's our bowels with our intestines, and the peeing with the urinary system and the kidneys. And of course, those are doing a lot of heavy lifting for us in regards to detoxifying the body and rebalancing the body. But there's also other emunctories that we often forget about, our skin being a really important one. It's got its own respiration process, as well as the sweating process, which is going to affect our electrolyte balance and our ability to regulate toxins at this very external level. And we have a very large amount of skin covering our body. So this is a big eliminatory organ. then there's the breath. We want to be thinking about how we are eliminating if we're actually breathing in nice, calm, cool ways throughout the day. I always like to think about getting at least 100 deep breaths in a day. And then for women, we also have the menstrual system. So the uterus is being a strong eliminatory organ as well. And then there's the mental and emotional piece too. Don't underestimate that as far as an emunctory, as far as a toxin eliminator. So it may not be a chemical component that we're releasing there, but there's a mental, emotional, spiritual component there.
So as naturopathic physicians, we are very concerned with vitality. And so what makes vitality is, all the positive factors are on the top, and then you minus from that those negative factors, the things that sort of take away vitality. And that's what leads you either in a state of health or in a state of disease. So if we look on the right here, the state of disease here in the center, there's stress sort of pushing down onto the internal resistant, that vis, that vitality piece. And when there's more stress, more external factors, more things getting in the way, obstacles to health, that leads you to a state of disease. There's not a way for you to catch up. And so in naturopathic medicine, we're really interested in sort of building that base, building that internal resistance and that vitality so that you can better deal with the stress. And of course, as we can, we sort of remove the stressors.
So I love this idea that there are more than one planes of the being. So we think about this material body that we all have, and underlying that are these biochemical reactions. Sometimes they're more silent than others. And then there's this energetic piece as well. And each of these are going to be affected, if you will, as if a table would be affected by either lengthening or shortening the legs in regards to structural components, elimination, how things are going there with our emunctories, nutrition, what's coming in, and that's a piece that we're going to be talking about with the supplementation, hereditary, so we're thinking about genes that start us off, what's the blueprint, if you will, and then there's the mental and emotional piece. So all of these are going to be affected, these three planes will be affected by these inputs. And we wanted to kind of really take a moment to reflect on these before we just jumped into talking about supplements, because sometimes it's very easy to think about like a math equation. If we add good, things will get better. But if we don't take the whole picture into consideration, then we're really missing out on a tremendous opportunity in regards to rebalancing and health.
So once we've sort of established those determinants of health, we can optimize health.
So when we're thinking about apothecaries and supplements, it's important to be thinking about where we are getting those things and also why it is that we're taking those things. So we always want to think about our motivation and then, of course, sourcing. So one of the reasons why we offer an apothecary through Prosper is so that we can ensure that our patients are getting high quality supplements, and we've been able to vet each of those supplements that are coming in, and they're physician grade. And what that means is that they have specific certification around them, and we're going to also get more into that. But just so you guys know, the apothecary is something that we have available right now for orders, but it's only through the Dropbox during this current part of the pandemic. So we will put stuff out in the Dropbox if people need those things right now. But otherwise, you can also order things through our e-store, and we also have vetted products through that. So that is the intro to the apothecary, the supplement shop through Prosper.
So having physician grade supplements has to do with this sort of stamp of approval, which is your GMP, your good manufacturing practice. And this is sort of a federally led way to vet supplements, because sometimes we don't know where they come from. We don't know who assembles them. We don't know how long they've been sitting on someone's shelf. And that's especially important with, products like fish oils that go rancid pretty quickly. And then instead of it being a healing anti-inflammatory thing, it becomes an inflammatory supplement. So we like to vet our products to have this seal of approval, because the GMP practice means that someone is looking, a third party is looking the whole way down the line, from where the product is sourced to how it's put together and how it's shipped out. And so, yeah, that's something that's very, very specific, and something that our apothecary really cares about.
And Dr. Rosalie, you actually have a really interesting perspective on this, I think, because as an Ayurvedic specialist and doctor, you have actually toured some facilities over in India. Would you share briefly about that and why we choose who we do as far as our manufacturers there?
Yeah, indeed. So a lot of the frustrations that I've heard from the Ayurvedic perspective in terms of Ayurvedic supplementation is that there isn't a federal inspection. There isn't that stamp of approval in some of the international products. And so it sort of has to happen from the inside out. And so a couple of one of the we'll say factories that I visited in India was the Ayush brand. And so they sort of showed us what their internal system looks like for ensuring that their products are pure and not containing any heavy metals. So essentially, from having seen that from the inside out, in terms of Ayurvedic supplementation, I generally, I speak very highly of Ayush.
So it does end up being really important for us, especially when we're thinking about herbs that are going in, whether they're being wildcrafted or grown organically, how they've been treated, how they've been cleaned. And a lot of our supplements from the different brands, the brands themselves will pull certain ingredients if they cannot access a certain quality, which is always I really appreciate it, even though it can be frustrating not to be able to get a certain product, but it makes me feel really good about the fact that they are having that third party go in and ensure the safety before they're buying quantities of those supplement components to put in. So for example, there was an issue with manganese several years back, and Olive Thorne they didn't pull all of their products that had manganese because they caught it before it went in, but they stopped manufacture on those products. And so there was, almost a year in which it was really hard to get those products, but all of them had been contaminated from this original source in China, really interesting, inside of a big barrel that had a blue leaded paint inside of it. And so it was really great that they were able to catch that from a chemical level really early on by doing testing to make sure that everything was nice and clean. So those products did not, endanger anyone. So in regards to our basic health supplementation, the way we have broken this down for you guys today is this understanding that, most people come to us thinking like multivitamin, that's where we start. So it is a really important one, and we're going to talk about that, but also we want to talk about our oils, our omegas. We want to talk about our flora, our probiotics. We've got our minerals that come in with our calcium and magnesium, and then our fat soluble vitamins, our D and K, and then we're going to add in the sprinkles on top of the cake, which is the antioxidants. And those kind of take us to that maintenance, that health maintenance piece and protection piece.
So there's so many brands of multivitamins, and you can get them from so many different places and so many different forms, and it's hard to know which are the best. So sometimes, we've got to think about, well, is form important? Like, how well are we digesting, a gummy versus a tablet? Honestly, the research shows that the gummy and the tablet form multivitamins are not digested quite as well and don't contain as much of the nutrients than the powders or the pills or the liquids. And then secondly, in that regards, often the number of pills is actually pretty telling. If you're having to take 3 or even 3 twice a day, you are getting the right amount of nutrients compared to your sort of 1 a day run of the mill multivitamin. There's just not enough in that. The quality of the specific minerals and vitamins within these multis is also very important, including when we're looking at our B vitamins. Since a lot of people have an enzyme deficiency that makes it difficult for them to absorb B vitamins. So that's why we always look for that methyl piece in front of, the longer vitamin name. So methylcobalamin is your B12 that we would suggest. Same thing with folate versus folic acid. One is natural and one is sort of chemically derived. Something else we think about is, whether to take iron or not with our multivitamins. Generally, iron will bind a lot of the other nutrients in the gut or in the multivitamins. So I typically like to sort of separate those out and sort of have a multi without iron. And then, of course, if we need to supplement in iron, then we would do it at a different time where it wouldn't compete with the binding. And then generally, we like to suggest that patients take their multis with food, since on an empty stomach, it could create some nausea. I mean, suddenly the body is digesting something that's chock full of really good things, and it sort of reacts to that. And multis can be a little bit activating, especially with the B vitamins in there. So we'll recommend that they get taken in the morning.
The other piece there is it's really important to look at the motivation behind, once again, taking those B vitamins. Or not the B vitamins, sorry, the multi. So if we have a person who is getting a complete complex of their nutrients from their foods that they're eating and does not have any issues with absorption or digestion, a lot of times we're not necessarily recommending that we start people on multiples. But if we're concerned that they're not able to get the variety of food that we want them to, or we're concerned with their absorption ability, a lot of times multiples can be very important. And at that point, we're thinking, do we need one that, they just need a little bit, maybe like a really good quality one a day, or do we need one that's much more complete that could be all the way up to 6 a day? And so that's really important to think about. And then that point that Dr. Rosalie made earlier about, if you take, for example, the cheap fish oil and it's rancid and it could do more problems, the same thing is true here. If we're taking a synthetic folate, for example, that's been shown from research to be correlating with increased cancer risk. So we don't like the synthetic vitamins. And so to me, multiples, even though they can seem like not a big deal, who cares, just take any cheap multiple off the shelf, they could actually be kind of damaging. So it is something that we really do want to think about, the quality and the form there. So with our question of iron or not, it's good to know, first of all, do you have an iron deficiency? So you have to think, like, do I have any of these symptoms? Do I bruise really easy? Am I really fatigued? Do I have any shortness of breath? Do I feel like it's really hard to recover whenever I'm working out or exercise or straining myself physically? And then do I have any difficulty with thinking or fuzzy thinking or memory issues? And those can all be signs of low iron. And if so, it's really important to get those numbers checked. Now, typically, we really like at Prosper to see our iron levels every year on a basic wellness panel. It's really important. And not just looking at iron and something called total iron binding capacity, but also checking in on a number called ferritin. And that really tells us about our iron stores, so what's available in storage. And then we always like to look at our CBC to see how the red blood cells are doing with circulating this iron and how we're looking in regards to anemia. That's the test that tells us the anemia status. And those are not expensive tests, and they're generally part of a nice, complete wellness blood draw that we like to do yearly. So if you are iron deficient, generally we're saying, hey, let's take some iron, and usually recommending it at a different time of day than the multiple, because that multivitamin is going to be really inhibited in regards to its ability to be able to absorb those other minerals that are in there, because iron really just steals the show. So usually we like to sell them and have them for people separately. There are a few exceptions in the Prosper Apothecary for our women who are pregnant, especially, or wanting to get pregnant, or prenatals. A lot of times those will have iron in there. And the reason we do that for a lot of those women, especially if they're experiencing nausea, they really sometimes only have one chance to get something in a day. And so in that case, we say, okay, it's okay. Let's put that iron in there and just do our best to get as much as we can out. But when we can separate it, we usually want to separate that iron.
So some of the favorite multivitamins we've got here at Prosper are, here on the screen. They're, like we mentioned before, some have iron, some without, some are, are just one a day or two a day, or some are powder forms. Some of these multis also, especially the second one, the one multi by Pure, has extra mitochondrial support in it, like CoQ10, etc. So it's really worth looking at labels and making sure and sort of cross-checking with your physician whether the multivitamin you're taking is adequate given sort of your digestive ability, your nutrient status, et cetera, et cetera.
So we wanted to make sure we touched base on our fatty acids today. And those fatty acids are so important because they're anti-inflammatories for us. And in our standard American diet, it's really challenging to get the ratio of fats that we need to in regards to those omega-3s. So we have this overabundance typically of our omega-6s and 9s in our diet. And we really want to be thinking more about those omega-3s because they will help us, and you can kind of see the biochemistry here, they will help us make these anti-inflammatory prostaglandins, which we need for regulating inflammation. And you guys might be hearing more about these inflammatory cascades, especially with COVID right now. So much in the news, people are talking about cytokine storms and things like that. And these prostaglandins are the type of chemicals that help mitigate some of that inflammation in the body. So we definitely want to have those anti-inflammatories on board in regards to these fats. So there's kind of two different main pathways here. There's our linoleic pathway, which is our omega-6, and our alpha-linoleic acid pathway, which is the omega-3. And the shortest way to get our omega-3s is taking marine lipids. You can see that kind of just cuts right to the chase and puts you down into those good prostaglandins, the 3 and 13 production. But if we're going to be taking a step further up the river, we could be taking something like flax or pumpkin seeds, and those will convert over as well, but they have to be converted by the body in several enzymes, and they require multiple vitamins. You can see there the B3, the B6, the vitamin C, the zinc, and the magnesium for those conversions to help that happen. Now, the omega-6 side, on the other hand, we can use sesame seed and sunflower seed, and these are great to include in our diet, but we need to be thinking about how do we keep that ratio a little bit higher towards those omega-3s, since those are more rare in our culture. So those fish oils, if you are not vegan, are a really great option. And then if you are vegan or for some reason cannot tolerate fish, then things like krill oil, or even going back to what the krill and the fish are eating in order to become getting those what's called essential fatty acids, and that's certain algae. So there are certain algae products that provide that anti-inflammatory fat. And yeah, so I just love that idea of it's an essential fatty acid, but where do the fish essentially get them from? They're not born with them, they're eating it. So just like we need to then ingest some form of that in order to help our normal brain processes, skin processes, that kind of stuff, and anti-inflammatory pathways.
So fish oil isn't just anti-inflammatory. It sort of helps with all sorts of processes in the body. That includes sort of fat as a building block. So I'm thinking of, you know, the fatty tissue of the brain, or creating the fatty hormones, or lining the organs or the skin just as a protective layer. So a lot of different uses for these fatty building blocks. But downstream is where we, if we go back to that biochemistry image, downstream is where we fit in those fish oils, and they're the ones that are the least inflammatory of the fats. And that's ultimately why they end up getting recommended so often. These three products, as we mentioned before, have been vetted. So what's really important with fish oil is that it hasn't sat for months or years on someone's shelf, and that it's a product that's pretty
Fresh.
pretty fresh from seed to table, we'll say. And so that's really important to look at expiration dates, and especially to pick products that aren't using farmed fish and that aren't overfishing to create their products. So one of our favorites is this Farmex brand, or the Finest fish oil.
So, and they come in capsules or liquid, and that's really up to what the person's comfort is. If they don't mind taking the liquid, it's the cheaper way to do it. So a lot of times, for getting the correct milligram in, we will want to have people take liquid if they're able to tolerate it. My kids love these kind of things because they taste good to them still. And so they'll like line up, which is always like, wow, really? So they're not that bad tasting because they're not rancid. And so a test that we like to do with people is we'll say, hey, go grab, for example, not to knock the Costco fish oil, but go grab your Kirkland fish oil capsules, cut them open, taste them. If they taste really fishy, then they've gone rancid because, they're probably not supposed to be sitting out on the shelf for over a year. So it's something to think about. And if that's the case, then we don't want that oxidized product for you because it's pro-inflammatory.
So our next piece here is our flora, our microflora. And probiotics are a way to externally get some help there into that internal environment. And they're important because they help sort of the digestive tract lining stay healthy. So there's a couple of the intestinal cells, and then there's proteins between them, and the probiotics sort of live on a layer above and sort of feed on that layer, and also ensure that it's nice, and there's a nice sort of mucus layer on top so that your own digestive enzymes don't affect your intestinal cells and start digesting those. So there is a nice community in there that is required.
We know that biodiversity for our flora is one of the most important determinants for our health. So we know from the research it helps us reduce our risk of chronic disease across the board. So when we think about what's happening to our external environment in regards to farmland, for example, and how we're monocropping things, the same sort of thing is happening for our gut flora in our culture, especially, whether it be from using antibiotics and things like that wipe out our diverse culture, or just eating the same 5 foods in a row really limits the amount of flora diversity that we have coming in. Also, even just having less dirt and soil and contaminants like that in our food reduces our microbiome scope to some degree. So things to think about there. When we think about our probiotics, the best study ones for the friendly flora are going to be our lactobacillus and our bifidobacterium. And these really, we've established, help regulate gut immunity. And that's a big deal because the gut-associated lymphatic tissue, which is called the GOLT, controls about 70% of our immune response. That's a really huge component of how we interact with the world in regards to our immune response. So this flora not only protects the intestinal lining from other microbes that might come in, but they also help produce a very important fat-soluble vitamin for us, which is vitamin K. So we don't get a ton of vitamin K from our food. Most of our K2, and we're going to talk about this in a second, is actually made by our good flora. And that ultimately affects things like our fertility, it also affects our bone health, things like that. So we do want to make sure that this flora is really well supported. And of course, with our probiotics, we're thinking about how do we get them? You know, how are we inoculated with them? We're inoculated at birth, but then we need to be eating foods that are fermented and rich in these probiotics in order to keep those levels maintained. Because every time we poop, we do poop out some of our good guys. So we want to be thinking about those sauerkrauts, kimchi, yogurts, even non-dairy yogurts as well, kefirs, those kind of fermented foods that are common in many other cultures, having those on a daily basis or thinking about taking a supplementation that would allow us to get those probiotics. And so we're pretty rigid about the probiotics that we recommend at Prosper as well. We want these, once again, physician grade, and more important to me almost is that the labs that are producing these are ensuring that they are what they say they are, because there have been several really scathing studies that have come out where the researchers have gone and bought 100 different brands and then tested the probiotics and said, oh my gosh, only one of these is the type of bacteria that it says that it is and the quantity that it says it is. So either there's too much or not enough or other random bacteria in there. And that's kind of very frightening. The other big piece here with probiotics that I always like to caution people about if they're just buying them over the shelf or on the shelf, is that a lot of times these probiotics are sourced from animal or soil. They're not human specific probiotics, if that makes sense. So if it's not a physician grade based lab, then typically they are getting these probiotics, like I said, from other like animal intestines or from plants or soil. And so if we want something that's specific for humans' immune response, and we want these subtypes of lactobacillus and bifida that are going to be appropriate for humans, then it's important to get a cell line that is a human specific cell line. And so that's one of the big pieces in regards to probiotics, where you really do get, you get what you pay for in regards to quality. And of course, you want to have the probiotics stored properly. And then there's always the question of how to take those. Maybe Dr. Rosalie, I'll let you mention the best way to take probiotics in regards to empty stomach, not empty stomach, because I think we left that part off the slide.
Yeah. So typically with probiotics, you do want to take it with food. So they are, the microflora of your body. When you add probiotics to them, you're sort of building that microflora. And what they do is they help with digestion. So you wouldn't want to take it on an empty stomach, because it would sort of be, it wouldn't be helping so much with digestion there. And there's potentially a risk of overgrowing your flora, which, can lead to something known as SIBO, or small intestinal bacterial overgrowth. So it is important to take these with food. And then if we are taking antibiotics for a reason or another, it's important to take them away from your antibiotics, because the antibiotics are going to kill off these healthy probiotics as well.
So just to clarify, we are usually recommending our patients who are on antibiotics to take the probiotics during that course, but just at a different time of day. So for example, if they have to take their antibiotics at morning and night, then lunchtime is a perfect time, or with a snack midday is a perfect time to have those probiotics. And we know from the research that that protects the people who are on the antibiotics, not just from having things like diarrhea, like common things that we see from flora disruption from antibiotics, or yeast infections, which are no fun either orally or vaginally, but also it helps protect them from something called E. coli, which is, as you guys know, we have this E. coli in our guts naturally, but if the other flora is killed off, if our other good guys are killed off by antibiotics, our chance of the E. coli being an opportunistic bacteria and really increasing its growth rate and overgrowing can be a big problem. And that's where we can get very severely ill with antibiotics. And a lot of times people will have to be even hospitalized that have that condition where they have too much E. coli. So, or sorry, not E. coli, C. difficile is what I was thinking about, but E. coli can do the same thing. So it can be equally as problematic there. So for C. diff reduction and E. coli, we really want to make sure that we have that good flora coming in to protect us while we're taking the antibiotics. The other piece that's really important to be thinking about our probiotics is how do we store them? There are some that are specifically okay to store shelf stable on the countertop. Others have to go in the fridge, and they should have been shipped from manufacturer in the fridge. And when you get them, you want to put them in the fridge. The ones that we have at Prosper that are the HLC, which stands for Human Live Culture, or HMF, which is Human Microflora. Those ones specifically have been what's called overpacked. So they're designed to be able to be at room temperature for 2 months without degrading. So they still deliver the amount that they say they will on the box to you. If for some reason you know that you're going to be traveling for 2 months and unable to refrigerate them, or I have a lot of patients that would say, oh, I'm taking, a road trip or something like that. Will they be okay, non-refrigerated or not in the cooler for 24 hours? And that's absolutely fine with those products. But generally, we always like to keep them refrigerated just to ensure that when you get them, you have the highest quality available for you. Let's see, are there any other things we want to mention about probiotics? There are just so many different types out there. There's, these lactobacillus-based ones, and then there's the Saccharomyces boulardii-based ones, which are fungal-based, which are the good fungus, the good yeast. And there's also these spore-based ones, which are really interesting. And those ones are generally the ones that are soil-derived. And there are times that we are recommending those for our patients as well. So it really does depend on what's going on with your gut flora and what some of your health imbalances are and health goals are. So a lot of times we will be looking at stool panels and things like that, especially with PCR analysis nowadays. It tells us, what is your flora looking like? Who's there? Do you have a lot of the opportunistic bacteria? Do you have too much lactobacillus or not enough? Those kind of things are very helpful for us in that regard.
So our next slide here is talking about antioxidants. And antioxidants work to combat inflammation specifically. So inflammation is kind of this broad term, but it ends up being very important because chronic inflammation is essentially your silent killer. Okay, it has to do with all chronic disease states. It's just gentle levels of inflammation throughout your life can sort of injure the tissues and lead to disease. In terms of healthy aging, we want to manage that inflammation. That's why we've heard a lot about antioxidants being used as anti-aging. It essentially has to do with decreasing and tamping down that inflammation.
So when we're thinking about antioxidants, in regards to food, I'm usually telling people eat the rainbow, because we see these in many, many different colors throughout the food that we eat. So we do want to be thinking about, am I having something blue? Am I having something purple? Am I having something red? What about orange and yellow? And how can I make sure that my plate has that diversity, not just for the flora, but also for the macronutrient content that's coming in that are going to have these phytochemicals, these plant chemicals that provide these antioxidants. And remember that fire of that inflammation is quelched by this antioxidant, so against oxidation reaction that happens, this chemical reaction. And these are what we call chemical donors. So they provide these hydrogens to calm down these biochemical inflammatory pathways. So some of the most common ones that you guys have all heard of on this list are the things like turmeric. You probably have all heard of your berries having antioxidants, and maybe you've heard about a lot of the medicinal mushrooms. Specifically, it's the beta-glucan that's in there that is the strongest studied component of these medicinal mushrooms that is an antioxidant. Some of my other favorites that grow really well around here are things like lemon balm, and we use even supplements of this as well, and licorice. Both of those are also very strong in regards to phytochemicals that are antiviral as well, which is just interesting, and astragalus, which is considered an immune modulator too. But one of my very favorite go-to antioxidants, if I have to just choose one for most of my patients, is a turmeric product. And turmeric just has so many beautiful studies showing that it's helpful for inducing what they call the apoptotic pathway, which basically means programmed cellular death. So what that's saying is it's helpful for the reducing the cancer pathway, so reducing cancer risk. And that's because it's such a strong antioxidant, but we also know it's anti-inflammatory. So for my patients who may have history in their family of cancer, and we want to be thinking about preventative ways to have antioxidants on board, that can be a really wonderful option for them. The other piece there is that because it's anti-inflammatory and helps with some of our pain pathways, it does a double duty in regards to if people have soreness or stiffness, that kind of thing, or sore joints or inflammation in the musculoskeletal arena, or even maybe in their menstrual process or something like that, where they need help managing pain. So I love turmeric for that. There's so many different turmeric supplements on the market. The one piece I always like to think about in regards to that is it already bioconverted, or does it need to have something to help the turmeric absorb? And so a lot of the products that you'll find will have black pepper in there, because according to the research, and we see this in culinary cooking too, when you add pepperine, it irritates the gut lining, which allows the phytochemicals of the turmeric to absorb in better. But for me, that can be problematic because a lot of my patients are coming to me with digestive issues in the first place. So I don't want anything that's going to increase their intestinal permeability, increase their risk of food sensitivities and things like that, or immune imbalances. So usually I prefer to have that already converted into an easily absorbable form for the turmeric when I'm thinking about it as a medicinal or supplement rather than a food source. So for a food source, absolutely add your coconut milk so you get the fatty component to help it absorb, and add some spice and it'll absorb really well. But if we're thinking about a supplement form, I do usually recommend for my patients that they are looking for one that's already been bioconverted. This is an example of one here, the Designs for Health one, that is bioconverted, and it's a pretty cool product. It's in this like gel cap, and so it's very concentrated. There's 1,000 milligrams per single capsule, or gel capsule, which is a very high, strong dose, very therapeutic dose for what we're going for. So usually it helps people to not have to take multiple handfuls of supplements. There are some times though that turmeric, for example, can be a more challenging one that we'll want to be cautious about. And that's where, when people have things like acid reflux, it can be a little bit irritating for some people. So we do have to think about dosing for that. Maybe they don't shouldn't be on a whole 1,000 milligrams at a time. Maybe they shouldn't be on a gel form, and instead an encapsulated powder form would be better in that regard. So just different things to think about when you're thinking about getting turmeric and taking it. But overall, it is one of my hands down favorite antioxidants, and it just does so many great things across the board for the body and fairly safe.
So these next few slides go into a food family that's high in antioxidants and high in very specific types of phytochemicals, which we'll sort of detail. But they can be taken as medicinal food, but also as supplements. And this is the brassica family. It's your cruciferous vegetables. So your cabbage, your broccoli, your cauliflower, your Brussels sprouts. They're sulfur-containing foods. And the sulfur is actually bound, it's bound to a plant piece, making it a phytochemical. And there's a couple here. There's the SGS, there's the sulforaphane, etc. These are really strong antioxidants, so they really quell inflammation. And there's been studies that 50 milligrams a day can really help sort of boost your antioxidant support.
And this one, I'll just say, is probably my all-time favorite antioxidants on the market. They say vitamin C is a strong antioxidant, and I've heard the analogy be like, it's like here as far as activity. So it's here. Turmeric is up here. It's like, good job, turmeric. But then this brassica, this sulforaphane, is up here. So if we think about people who are taking vitamin C as a daily to keep them protected, they're being helped out here. But this is pretty amazing, this sulforaphane. And what they did here is some of the original research was done through Johns Hopkins, and they took a large amount of broccoli seeds and they sprouted them, and then they extracted out the sulforaphane. And so to be able to get this quantity, you'd have to eat like something ridiculous, like 5 pounds of sprouted broccoli seeds. So this is definitely now converted in from what we'd say a food-based nutritional to a nutraceutical, where it's actually being used as a very potent nutrient at this point. And so with that, it's been bioconverted. So normally you have to chew the little sprout and you have to masticate it, and it breaks it open, and then your flora in your gut actually has to convert it and make it bioavailable so it can be brought in. This one's already co-converted, so it's in this SGS form, and because of that, it is just so easy for people to absorb and to use. The only downside is the expense of this product. I want to say it's around 50 or 60 bucks for a month's supply if you're taking a therapeutic dose, like something that we would give for our patients who are oncology patients who are.
Oh, did we lose? Let's see, it looks like we lost Dr. Molly. Let's see.
Okay, can you guys hear me? I don't know where my screen share went. Could be. So sorry. Okay, that was wild. I think I might have had a little power outage or something. But you guys are still here, which is great. So anyway, sulforaphane, awesome stuff. But it does end up being something that, I'll usually use for people, once again, who have more concern about like cancer risk and things like that. But it is something that, for me, I'll personally alternate this through my supplement regime. So I'm not constantly taking the same antioxidant. So a few times a year, I'll go through a bottle, for example, of this brassica, this sulforaphane, the Braco Protect. And the reason that I do that is, for me, I do have a high amount of breast cancer in my family. I've got it on both sides. So it's something that's part of my preventative routine.
There's other really great phytochemicals in the brassica family, including indoles and diindolylmethane that are specific to breast cancer reduction. And it has to do with the fact that they interfere with the estrogen receptors, or they help with the body's digestion of estrogen. And so the indole 3-carbinol, has been used as a preventive for breast cancer. It's also been used as a preventive for cervical cancer or precancerous cells of the cervix. It helps process the estrogen specifically, and then the diindole methane moves the estrogen from the more inflammatory type known as estrone and converts it back into estradiol, E2, and that's the one that's your less inflammatory type of estrogen, hence why it's been used in cancer reduction.
So the third cabbage family, broccoli family, subtype of phytochemical we want to touch base on with you guys is this calcium D-Glucrate. Now, it sounds like this is a calcium product that might be good for your bones, but it's really not the calcium in here. That's just a mineral that the D-Glucrate, the glucuronic acid, can attach to. So as far as our calcium D-Glucrate goes, it's something that we find in our cabbage family, of course, but also in oranges, which is kind of interesting. And it's one that is really phenomenal because we know that it helps with that detoxification, that amonctory process along the intestinal lining. So there's on the brush border of our intestines, there's something called glucuronidase, which is this enzyme that helps us with removing excess chemicals, whether they're toxins that we've eaten or ingested or come in contact with from our external environment and absorbed, or if they're excessive amounts of hormones, which to the body can be seen as toxins. So this product, we know calcium D-Glucrate, according to the literature, helps reduce our breast cancer risk, it helps reduce our uterine risk, cancer risk, and even prostate cancer, once again, because of these hormone levels that are affected by this, and helping us get out those excess chemicals, those excess toxins through the stool, through that elimination process. And then the other cancer that it's been shown to reduce the rate of is colon cancer, which is another really important one. Once again, we're cleaning through this intestinal amunctory, this elimination pathway. So we can get this from eating these wonderful foods. If we want it from a higher source, or if it's something, an antioxidant that we want to be including occasionally throughout our supplement routine, or as more of a continual one because we're concerned about any of those cancer risks for family history or personal history, then those are then it's a really good option, that calcium D-Glucrate, and a very low side effect risk. I've never had anybody have a reaction with this one. It's very easy. It doesn't have the sulfur base that sulforaphane does. So I have the occasional patient that might be breastfeeding or something like that that says, oh, my baby gets gassy whenever I eat these sulfur-rich veggies. But this is an extract with just that calcium D-Glucrate, and it's very easy on the body.
So our second to last category here are our micro minerals, our calcium and magnesium. And you can get these from your multis, but sometimes it's worth supplementing them in. It's rare that I suggest just a calcium supplement, but more often it's a magnesium supplement that I'm helping bring in. And it's because these micro minerals, they are a big component of the bones, and sort of help the bones build, in addition to like many other things we'll go into.
So as far as bone density, you guys know this, especially if you attended our bone health talk. And if you didn't, I believe that there is a video of that on our website, so make sure you don't miss out on that. But remember, there's different stages of bone weakening and bone thinning process. There's the word. So we've got our normal bone tissue, and when it gets thinner, we get into this osteopenic area, and then we can go all the way to osteoporosis, where the bone is quite thin and almost looks like Swiss cheese when we look at a slice of it. So of course we don't want that thin process to happen because we are more prone to breaking or fracturing. And it's a silent disease. So especially as women, we might not be knowing as we age that we're having that bone breakdown and that remodeling happen. So remember, bone is living tissue, and it is going to be going through these remodeling processes every 2 to 3 months. We have this cycle of turnover, and we have this blast, this osteoblastic, which is the building component that happens at the cellular level, and then this osteoclastic component, which is that breaking down of the bone. And of course, we want to be supporting the osteoblastic activity, that building activity, as we age.
So a lot of things to think about when supplementing calcium and magnesium. We do like to see them together. They help each other get absorbed. But we can consider, which delivery format is best: liquid, a powder, a capsule. I typically, honestly, will suggest a powder at night, since it's sort of pretty easy to mix into water, and magnesium has the added effect of being calming. But typically we like to see the ratio of 2 parts calcium to 1 part magnesium. That's sort of the best ratio for absorption. And it depends on the body and the pathology, but the typical dose will be 600 to 1200 of calcium, and then 3 to 6 of magnesium. And then it will depend on, a lot of factors, whether you take it with or without food, during the day or before bed. Like I said, I like to do it without, I like to suggest it without food, and then before bed, since that's sort of the best way that it's absorbed in a water medium.
And one of the reasons that we'll sometimes do the calcium, magnesium with food is if you have kidney stones. We know that especially if we're giving a citrate form, it helps reduce that calcium carbonate stone production and the oxalate stone production, sorry. So if we gave calcium carbonate, that would actually increase our risk of stones. So we usually do citrate, and then that helps bind away those calcium oxalate stones. And so we'll do that at dinner time for those patients. And then as far as magnesium, it is one of our favorite minerals. And we want to think about that not just for our bone health, but our sleep and our muscles, because it helps our muscles relax so we don't get sore or tender, especially after our aerobic exercise. It helps with our mood stabilization. And we know it helps relax those micro muscles that are in the blood vessels. So it helps reduce our blood pressure and helps keep our cardiovascular system healthy. So too much of it is going to make you poop. So we don't want to be taking too much of it. So if you get closer to that 500-600 milligram range, for some people that can cause loose stool. So do be cautious about that. Usually, once again, we do like that magnesium in the evening because it helps with relaxation. There are times I'll give it in the morning because it can help with anxiety though as well. So it's important to think about timing with that. And then there are lots of forms, just like there are lots of forms of calcium. So the ones that we're usually choosing from are that magnesium citrate, which is the one that we love if you have kidney stone history, and then the mag glycinate is one that is really easy to absorb. So if you have issues with your intestinal system or with magnesium absorption in general, that's a nice form. Mag malate is one that's been shown to be really good for sore muscles. And then magnesium threonate is one that we know crosses the blood-brain barrier and can be helpful for our mental component and reducing things like migraines. And if you've had head trauma or something like that, we usually like that one.
So here's a product we carry that we really love. It's in its liquid form, and it also has other microminerals besides the calcium and magnesium that help with bone building specifically. And so this is a special product because it's formulated to sort of be taken at night when the bone building and the healing process happens, and in a way that is best absorbed by the body.
So that liquid tastes like blueberries, and so it's my kids' favorite. They don't have very much dairy in their diet, so they end up having a little spoonful of that every night, and they're always asking for it like a dessert. But there are cases where we might not want something, even though that one's just sweetened with stevia, we might not want something like that that's sweetened for somebody at the end of the evening. So there's another product that we use quite a bit called Osteoben. This one's really cool because it has research done where they took multiple DEXAs over DEXA scans, which is a scan to tell somebody how severe their bone loss is over multiple years, and looked at patients who were on it and saw that it actually increases that osteoblastic, that osteo building, the bone building for patients, which is really nice. And I've seen that now in my clinical practice because I've been using it for, I think, about 5 or 6 years. So I really love this one, especially if we're dealing with more severe osteoporosis. It's one that helps balance out with an antioxidant, genistein, that's in there. So it's not just using just our calcium and magnesium. It has K and D in it as well. And then this genistein, which is known to be a helpful one for bone support.
So last but not least category of heavy hitting supplements for health is this vitamin D, vitamin K category. So we've probably heard that, in this region of the world, the sun doesn't shine quite as strongly enough onto our skins for us to make enough vitamin D from that method. So it's really important to have your vitamin D levels checked and supplement accordingly. Honestly, clinically, I've seen this come back low many, 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 many times. It's such an important fat soluble vitamin because it helps the bones build. It supports your immune system. It's also mood supportive. There's been studies that show that low vitamin D is linked with depression. And then lastly, the big piece we forget is that vitamin D is also a pro-hormone. So it's got the same building block as your estrogen, for example. So it sort of helps support that hormonal pathway. D is often linked with vitamin K in formulas since it helps absorb. The vitamin K being present helps the vitamin D get absorbed. And like we'd mentioned prior, vitamin K is an important part of the bones, and so it helps build bones.
So sources of D, and then we'll mention K as well, we often will get this through food if we were to be eating liver, which many of us are no longer doing in our culture. But a simple way for us to think about finding this which would potentially support our essential fatty acids, our omega-3s that we talk about, would be taking cod liver oil, because cod liver oil is going to have the D as well as our vitamin A, and it has those essential fatty acids, those omega-3s. We also get, of course, D from sunlight. Dr. Rosalie just mentioned that, with us being Northwesterners. And we know that we can get this through capsule form, liquid form, so many different forms. Usually we're trying to do the most cost-effective thing for our patients because they're going to be taking the D more long-term. So I love it in a drop because it's cheap. You don't have to pay for the encapsulation process. You can get 2,000 IUs per drop, and so these bottles last a long time. There's 900 drops in a bottle, so it ends up being very cost-effective to do it that way. If you're going to combine it with K, then it can be more effectively absorbed and is great for bone. So when we're thinking about bone loss and osteoporosis prevention, we're really thinking along that line.
So quick plug about vitamin K. As we mentioned earlier in the presentation, probiotics help make vitamin K in the GI tract. So it's really important we've got a healthy microflora doing that for us. But we could also get vitamin K from foods. They're a little bit less well absorbed. They come in a form known as vitamin K1. The one that's typically paired with your vitamin D is the K2 form, and that's the one that's shown to sort of help bone build specifically. You never want to take the K3 form. I honestly rarely see it anymore on the shelves. But yeah, this is just a quick summary of your vitamin K?
So just to remind you guys, if you don't already know, there is this week, it happens to be our 10% off annual sale for both of our in-office apothecary items, as well as what's available through our e-store online, which is prospernaturalhealth.com. So please take advantage of that if you haven't already. We are taking those orders to either put out through a drop ship method this year, where it comes straight to your house from the manufacturer, or it can come through the e-store, which is also straight through manufacturer. So you should be getting very fresh products in a safe way during the pandemic. So just as a reminder, we wanted to make sure that we did that during our little talk on supplements. And then we also want to, of course, invite you to our doc talks for next year. We just released the schedule for that, and it's online now on our website as well. So once again, prospernaturalhealth.com, and you can check those out there. The talk in January is going to be a fun one about weight management and holistic approaches.